Hello everyone. So this is my first full video and I'll be teaching here. First of all, I'm taking fundamentals of nursing and first topic I'm taking fluids and electrolyte. तो फ्लूइड्स एंड इलेक्ट्रोलाइट बहुत इंपॉर्टेंट है. इससे बहुत क्वेश्चंस हर साल नोटसेट में आते हैं, तो आपको बहुत ध्यान से पढ़ना है. तो पहले हम इसमें पढ़ेंगे टॉनिसिटी ऑफ सॉल्यूशंस. So tonicity of solution, as name suggests, tonicity means concentration of solution. So this is divided in three type of fluids. Based on tonicity, solutions are divided in three type of fluids. So what are they? Hypotonic, isotonic, hypertonic, as you all know. So they are, what are they? Hypotonic, isotonic and hypertonic. So first of all, hypotonic. Hypotonic, as name suggests, less tonicity. It means what? Water content move from cell to move from so water content move from vessels to cells. Means water comes in the cells. So if water coming from vessels to cells, what will happen? Cells will swell, or we can say cell size will increase. Then next, what are the examples of hypotonic? So hypotonic solutions are 0.33% NaCl, then 0.45% NaCl, or we can say half saline, half of normal saline, then 0.22% NaCl, and also dextrose, 5% dextrose in water. Inside the cells it is hypotonic, but outside it's isotonic. That we'll see next. And where we will use this hypotonic solution? We'll use in dehydration. So in dehydration we'll use. Then in fluid volume deficit we will use this. And important, where we should not use this hypotonic solution, where we should avoid, मीन्स बिल्कुल भी नहीं देना है. अगर देंगे तो उससे और कॉम्प्लिकेशंस बढ़ सकते हैं. तो किसको नहीं देना है? पेशेंट विद इंक्रीज आईसीपी. अगर हम देंगे तो आईसीपी और ज़्यादा बढ़ेगा. देन बर्न्स, वी शुड नॉट गिव इन बर्न्स, एंड ऑल्सो वी शुड नॉट गिव इन ट्रोमा केसेस, hypertonic solution, etc. So these three things you should remember because these are important. Okay, so this is overall hypotonic. So what is it? Water from vessels to cells, cells swell, and these are the example. And we'll use in dehydration, fluid volume deficit, and cells swell, and or size increase. And we should avoid in patient with increased ICP. Next we will read isotonic solution. Isotonics means equal. So there will tonicity of the solution will be equal to the tonicity of body cells, we can say. So there is no difference or no cell size change will be there. Or we can say no cellular change. So next, what are the examples of normal isotonic solutions? First of all, 5% dextrose in normal saline, or we can say NaCl. Okay, then we have normal saline, and we have ringal lactate, we have D5 water outside the cells, and we have 0.9% NaCl. We'll say like normal saline. So these are the examples of isotonic solution. It's easy to remember isotonic solution, like 5% dextrose in NS, RL, and D5W outside. You can like leave this T5W because it creates a confusion. So where we'll use in fluid maintenance, whenever in hospital we are using, and then replacement of fluid if a nausea and vomiting will be there, or in burns we can use this, and also in dehydration due to nausea and vomiting. So these all are the use. If you like my content, please like, share, and subscribe. So RL, it is preferable choice in buns. This question asked in many exams, like in norcet many times. So you should remember this, like ring elected preferable choice in buns. And next we'll see like isotonic no cell change that I have already told, and then next we'll be seeing hypertonic solutions. So hypertonic solution is the name, as the name suggests what it is, like osmolarity will be more than the body fluids, or tonicity of solution will be more than the body cells fluid or plasma. So what will happen here? Water, like water comes out from the cells. Okay, move water out of the cells. So what will happen? There will be shrinking of cell, and cell size will decrease. If water comes out, then cell size will decrease. Next, what are the examples? So examples are, first of all, dextrose 5% in ring lactate, and next we have 3% saline or 3% NaCl. We have 5% saline, and we have dextrose 10, or we can say D10 and D 50%. These all are in hypertonic solutions. So hypertonic solution we'll use in, where we are gonna use them in increase ICP. Increase ICP, we can say there is preferable choices mannitol. In increase ICP, in like drug of choice or fluid of choice is mannitol. Then next we can, like there is a very important thing we should not in when we are administering hypertonic solution. What is that important consideration? So there is important consideration is that we should watch out for pulmonary edema, because if fluid overload occurs, there can be chances of pulmonary edema. So whenever patient is on hypertonic solution, we should watch out for pulmonary edema and fluid overload. And fluid overload also can cause chronic heart failure. So this is all about fluids and electrolyte में tonicity of solutions. This is very important. You can take screenshot of this, or you can write it down. Many times questions come from this. So that's all about tonicity. Next we'll start fluid imbalance. I'm preparing this first time for you all. So if you like my channel, or if you like the content, you can like, share, and comment. And if any doubt occurs, you can comment below so I can clarify. And also you can give advice like how can I improve, or what all things I should add. So fluid imbalance, there are two types: fluid volume deficit, fluid volume excess. So first we'll be studying fluid volume deficit. Means there will be decrease in the fluid volume in the body. Means water content decrease. So what sign and symptoms will be there? First of all, we should think like water is decreasing, so there will be flat neck veins. So we should remember this, there will be flat neck veins. And next we have dry skin. Dry skin, or we can say poor skin turgor, will be there in fluid volume deficit. In skin pinch test, we can check like turgor. And next, if fluid volume is decreasing, there will be constipation and there will be oliguria. So oliguria means there will be less urine output. So when we are saying there is less urine output, this you should remember, like what is the cutoff range of saying oliguria. So oliguria, reduce urine output. Urine output should be how much? Urine output should be less than 400 ml in 24 hours. So if urine output less than 400 ml in 24 hours or less than 0.5 ml per kg per hour, so we'll say there is oliguria in this patient. So this cutoff range you should remember. They can ask this in like prelims, they will ask direct questions, so they can ask this. And together we can study there is one more term, anuria. So anuria, as the name suggests, there is there can be no urine output. That can be the first thing. So what we should remember? No urine output, or we can say if there is less than 100 ml per day or in 24 hours there is less than 100 ml urine. So these both things are important. You should remember this. Next we'll go to our topic like fluid volume deficit. Symptoms we were studying. So there is one symptom, oliguria. And next, after oliguria, so next we have other symptoms are weight loss. So there will be water content decrease and weight will be decreasing with that. And we also have, so what are the symptoms we have? Shock. And shock will be what kind of shock? That will be isotonic shock. Means overall fluid volume is decreasing. There is no like hypotonic or hypertonic. That will be isotonic shock. Next, in vitals, what changes will be there? BP will decrease. So BP decreasing, and alternatively there will be pulse rate increase and respiratory rate increase. And there will be one important thing that we should remember is pulse pressure. How we are calculating pulse pressure? Systolic BP minus diastolic BP. So pulse pressure in this case fluid volume deficit, that will be narrow pulse pressure. So this we should remember, narrow pulse pressure. Next, CVP will decrease. In CVP means central venous pressure, as we all know, and CVP is depending on the water content. If water content is decreasing, means CVP will be decreasing. And next, we will be seeing what is the normal CVP value. That you should remember. It's a direct question. 5 to 10 centimeter H2O, or it will be 3 to 8 millimeter of mercury. So this two value we should remember. 5 to 10 centimeter if they will ask in centimeter H2, and 3 to 8 mmHg if they will ask in millimeter of mercury. And hematocrit will be increasing. So hematocrit will be increasing if volume of the plasma is decreasing, means blood content is increasing or blood concentration is increasing. Blood will be more concentrated. So as I have told, CVP will be decreasing, not increasing. So these all are simple things that we should remember, and questions are coming from these. This is very important topic, fluid volume or fluid imbalance. So what is the management of fluid volume deficit? We can give IV fluids, and this is the most simple way we are treating fluid volume deficit in the hospital. And we are also checking intake and output to make sure there is normal output or the recovery of patient. So we'll be checking intake and output. So this is all about fluid volume deficit. Next, we'll be studying fluid volume axis. As the name suggests, fluid volume axis means there is volume of fluid is more or plasma volume will increase. So, what can be sign and symptoms? Periorbital edema. Around the eyes, periorbital, around the eyes, there will be edema and distended neck veins or jugular veins, we can say. So we can feel or it will be visible distended jugular vein. And fluid volume is increasing means there can be chances of congestive heart failure. If fluid volume will increase, heart will not be able to pump the fluid properly, so there can be congestive heart failure. And next, if fluid volume increasing, then ICP will be increasing. Fluid volume in the brain will be increasing. ICP will increase means there can be chances of level of consciousness will decrease or drowsiness will increase. So this is the important sign, like level of consciousness will be decreasing in increase ICP, and this we should note for. And next, what we'll be seeing, vitals. In vitals, that will be opposite of fluid volume deficit. BP will be increasing, pulse rate will be decreasing, respiratory rate will be decreasing. And next, most importantly, pulse pressure. As we have seen in fluid volume deficit, there will be less or narrow pulse pressure, but in this fluid volume axis widened pulse pressure will be present. So this we should remember. Next, we'll be seeing in heart, if there will be congestive heart failure, if left side of heart failure, what how we can identify. So there can be pulmonary edema, and there can be chances of crackles or rails. These are the lung sound when we be listening in left side of heart failure. There can be difficulty in breathing or shortness of breath. Patient will complain of shortness of breath in left side heart failure or left side heart congestion. And there can be coughing also can be there in left side heart failure, congestive heart failure. And next, right side, if right side heart failure, there can, what are the sign symptom can found. So there can be generalized edema, and also there can be ascites. Ascites means fluid in peritoneal cavity. And next, weight gain can be there in right side heart failure. So these two congestive heart failure we should remember. Next, we'll see like if when fluid volume excess will occur, what can be the management, how will be managing in hospital. So management, 3Ds we should remember. This is the important trick I'm telling. 3D. First D is for diuretics. We'll give diuretics so excess fluid volume will go out through urination. We can do dialysis if it's more fluid, and in congestive heart failure we can give disoxin. So this is 3D. And also we should replace the albumin replacement is very important to maintain the osmotic pressure in the cells. So these are the important fluid volume imbalance things. We have studied fluid volume deficit, fluid volume excess. You can take screenshot of this, and or you can write the notes. It's very important. In next video we'll be studying electrolyte imbalance, so stay connected.